I'll now turn it over to Governor Cuomo.
Thank you very much. Good morning, Andrew Cuomo here. I'm joined by Melissa DeRosa, Dr. Howard Zucker, Gareth Rhodes, Beth Garvey, and Robert Mahica. Today is day 179. New York did 71,000 tests yesterday, and it's continued good news for New Yorkers who are continuing to act smart and united and disciplined. 0.79% is the infection rate. That's the 19th straight day that it's under 1, so that's very good. 3 New Yorkers passed away from COVID, and they're in our thoughts and prayers. 492 hospitalized, 136 in ICU, 54 intubated. The situation was good all across the state. We still have a caution flag for Western New York, which is at 1.4% today. It's better than it was, but not where it should be. So we're focusing on Western New York, and we'll continue to do that. Our enforcement efforts are continuing. The infection rate isn't staying down by anything other than the consequence of our actions. So we're continuing the enforcement actions. We did 1 in Brooklyn, 1 in Queens, 1 in Staten Island, 1 in Suffolk. Those are done by the State Liquor Authority and the State Police. I again call on local governments. They're supposed to be doing the compliance. They don't make the decisions of what opens and what closes, but they do the compliance, and they have to do a better job. New York City needs to use the NYPD. New York City relying on its sheriff's department to do compliance is not going to be effective, right? There's only 150 people in the sheriff's department. There's 30-something thousand NYPD. I understand the issues they have in New York City, but they have to do compliance. Otherwise, you're going to see the numbers go up. A couple of comments on national situations. The president announced that he would be nominating his acting Secretary of Homeland Security, Chad Wolf, to be the permanent secretary. This is just a couple of weeks after the U.S. Attorney in the Southern District refused to advance Wolf's lawsuit against New York State, where we sued them on the Trusted Traveler Program. I was former Attorney General. I've never seen a U.S. Attorney say that they will drop a lawsuit because the allegations made by the department are false. Chad Wolf made false allegations. He said that New York State was the only state that had a green light law that didn't allow disclosure. That was false. That was knowingly false. It had been publicly discussed. Wolf and his department very well are aware of those laws. And the U.S. Attorney said that he was making false statements. Trump's response is to nominate him to be confirmed. The House of Representatives said that they were considering an investigation. And the Attorney General Barr, if he was a real Attorney General and actually serious about his oath of office, he would be investigating how a department for many months was conducting a political vendetta against New York State rather than allowing the president to advance Wolf and Cuccinelli, who are thugs. That's what we would call them in New York. Rather than advance them for nomination, they should be advanced for investigation. And I hope the House of Representatives does do the investigation. And if the U.S. Senate confirms these people, it is the ultimate disregard for the rule of law, which is a continuing theme with this administration, but would literally take it to a new level. Talking about the hyper-political nature of this administration, the CDC put out new guidance that really strains credulity. The CDC on Monday changed the guidance to say if you have been in close contact with a person who was infected with COVID, you do not need to get a test. Okay? This reversed their previous guidance, which was if you were in close contact with a COVID-positive person, you needed to get a test. They reversed their own guidance. If you are in close contact with a person, you don't need to get a test. I've spoken to health experts from around the globe. None of them will say that this makes any sense from a health point of view. The only plausible rationale is they want fewer people taking tests because, as the president has said, if we don't take tests, you won't know that people are COVID positive, and the number of COVID positive people will come down. Yes, that is true. That is his policy of deny the problem. If you don't take your temperature, you won't know that you have a fever. Yes, that is true. But it totally violates public health standards and rationale, and just fosters his failed policy of denial. COVID's not a problem. It's going to be gone when the weather gets warm. It's going to be gone by Easter. There's only a COVID problem because we take tests. He now has CDC carrying forward his political agenda. And it is frightening, and it is alarming. And when you can politicize public health, which is actually politicizing national security. Now, he's consistent in his politics over government because he is politicizing national security when he nominates Chad Wolf to be the head of the Department of Homeland Security, who was just a political operative. Department of Homeland Security is what the president uses to build his wall, to put children in cages. That's all done by the Department of Homeland Security. So he made the Department of Homeland Security a political operation, and now he's making the CDC a political operation. It is frightening. It should be frightening. This is the same CDC that was supposed to guard public health and was supposed to track the virus that was in China last December. It's the same CDC that showed that they either lied to the American people or they're incompetent because they didn't track the virus in China. And they didn't track the virus leaving China and going to Europe in January, February, March, and that's why New York was ambushed. That is a fact. It's not a political statement. It's not hyperbolic. It's not rhetorical. It is a fact. And that's why New York had the number of cases it had. because the flights from Europe came here. It's not the China virus. It's the European virus. The European virus, because it came here from Europe. And the CDC either totally missed it or they were ordered not to speak about it. And this just evidences, once again, political control over what's supposed to be a public health organization. The history books are going to record this. Shame on the people in the CDC. These will be indefensible actions in the light of history. Indefensible. What possible rationale is there to say you're in close contact with a COVID-positive person and you don't need a test? What plausible rationale? And this from the same CDC that already disgraced itself when they said there's no such thing as asymptomatic spread, and then totally reversed themselves. This is the same CDC that said the transmission is when a person who is symptomatic coughs or sneezes, and then did a full 180 and said, whoops, they can also transfer it if they're asymptomatic. When, by the way, doctors around the world were already saying that. And how do they rationalize their position where you can have asymptomatic spread by now saying you don't even have to have a test? They also did a 180 on the quarantine rule, where now they say you don't have to quarantine if you're coming in from a country that is a hotspot. On what theory? Why would you reverse yourself on the quarantine order? Because they don't want publicity that there is a COVID problem. Because the president's politics are COVID isn't a problem, we're past COVID, it's all about the economy, and the economy's doing great, and we're going to focus on the economy, and that's his re-election strategy. So he's using the CDC as a campaign rhetorical device. This is all his political public relations. Also, on the wildfires in California, Americans were very good to New York when we needed help, and I will never forget it personally, and New Yorkers will never forget it. And we're going to show the same love and mutuality they showed for us, and we're going to be sending forest rangers to California to help fight with the forest fire. With that, I'm going to turn it over to Dr. Zucker for some comments, and then we'll take questions. Thank you. Dr. Zucker?
Sure. Thank you, Governor. Regarding the CDC situation, this is indefensible from a public health point of view, and I have to say it makes absolutely no sense. And I've spoken with the scientists at the CDC, and they say it's political. So I concur with all that you're saying, that this is just indefensible. And,
thank you, Doctor. Okay, questions?
Ladies and gentlemen, if you wish to ask a question, please press star 1 on your telephone. Again, if you wish to ask a question, please press star 1 on your telephone. Please hold while we compile the Q&A roster. First question from Fred Mogo. Your line is open.
Yes, hi. Good morning, Governor. I had a quick question for you. Obviously, you said and have emphasized repeatedly that it's up to local law enforcement agencies to enforce, problems with gatherings and so forth. I wonder, nonetheless, if you could, if you have an opinion about reports that there have been steadily increasing massive weddings in various parts of the state and city, but particularly within Hasidic communities?
Look, there's all sorts of rumors. If anyone has any specific information, they should forward that to authorities because it violates the law. It's that simple. It violates the law. And in the case of New York City, if there's any evidence of or plans for a wedding that would violate the law, they should forward those complaints to the NYPD and the mayor. If the mayor is not doing the enforcement actions, then the state will. But it is the primary responsibility of the local governments. And the state liquor authority, the state police, we don't have the capacity to substitute for the local police department all across the state. There are about 6,000 state troopers, let's say. 6,000 state police. There are 32,000 NYPD. 6,000 statewide troopers can't substitute for 32,000 NYPD. Or Nassau County Police, Suffolk County Police, Westchester County Police, etc. And that doesn't even count the local police departments, right? But if they have, that violates the law, we will enforce it. We've been enforcing the law very aggressively. That's how the infection rate stays down. So if anyone has, go ahead.
No, so obviously the enforcement issue and jurisdictional issue is massive, but just I wonder if there's anything that you're concerned about, aside from enforcement, just that these culturally, that this phenomenon seems to be returning to a status quo and seems to be building up. Is there anything you want to say about that on the cultural or political level, in addition to the strictly law enforcement level?
Yeah, Fred, it's ignorant to do that, right? It defies everything we learned. We've had super spreader events. We've had super spreader events in New Rochelle with the Jewish community. We've had them in the Catholic community. The virus does not discriminate by religious or racial lines, right? This is an equal opportunity situation. So we police it in every circumstance. We don't have any evidence that it's worse in the Hasidic community. We haven't gotten those complaints. If we do, we will follow up and investigate. But in any situation, it's just not only illegal, it's ignorant. And it's whether it's young people at a bar or it's a religious wedding, it's the same thing to me. It's ignorant, it's disrespectful, and it violates the law. And if we get a complaint, we'll follow up and we'll investigate it immediately, which is we've been very aggressive in the enforcement, and we'll continue to do that.
Yeah.
But Fred, the other point is also important. If we do get complaints, do we have the capacity to investigate all the complaints? Not without local enforcement. And that has not been happening. And I have said it repeatedly. But somebody has to answer the question in New York City, how do you expect 150 sheriffs to do all compliance on these matters and quarantine control and border control? It doesn't make sense on any level.
Next question, Andrew Seth from WMBC TV.
Governor, how are you? Hope you're doing well. Today, Pat Boy and other MTA executives said without the $12 billion in federal funding, they'll have to cut service 40% and lay off 7,000 people. My question to you is, why does that money have to be federal funding? Is there not a measure you as governor can take, such as a tax increase, such as shifting state funds to prevent the MTA from these kind of job cuts and service reductions?
No, it is not mathematically possible. Because if there's no federal aid for the MTA, that means the federal legislation wasn't passed. If the federal legislation isn't passed, it means there's no funding for the MTA. There's no funding for the Port Authority that is trying to build airports and operate the tunnels and crossings. There's no funding for schools. There's no funding for hospitals. There's no funding for local governments. There's no funding for police. There's no funding for nurses. There's no funding for teachers. It would be a financial catastrophe for the state of New York. And there wouldn't be one hole in the dike called the MTA. There would be 50 holes in the dike. It will be a shotgun blast at the dike, and you couldn't possibly fill all the holes, right? It's not a situation, we're not anticipating a situation where the MTA is the only thing not funded, Andrew. There are 30 items in that federal legislation, and it means none of the 30 would have been funded. And there is no way, if you increased taxes to the highest level in the country, to the highest level ever established, you wouldn't come near the amount of money needed to fill the holes. And that's why the message is to these congressional representatives, don't come home and run for election in November and think that New Yorkers are not going to hold you accountable for what you did. Yes, Long Island Railroad service will be cut. Subway service will be cut. Yes, Port Authority will slow construction. Fares will go up. Tolls will go up. Hospitals, schools, police, New York City workers, New York State workers, Nassau County workers, it would be a financial catastrophe.
Next question, Lindsay Kramer from Post Standard.
Hi, Governor. Thank you for your time. Today's question for me is a little bit sports related. It's a follow-up on your announcement earlier this week about football and other sports, specifically football, high school football. So my question is sort of a two-part question. With states around New York with similar or maybe not as good as infection rates jumping and playing high school football, could you take me through a little bit of the rationale as far as holding off in New York? And at some point, there needs to be, decision made. The kids are practicing. Will there be a season? What is it specifically that you'd like to see, and by when, for you to say that football is doable in the fall season?
Okay, I'll ask Rob or Beth to comment, but just on the premise of your question, these are all value judgments that we're making. And the balance on the judgment is always the same. Increase as much increase the activity to the rate of normalcy as quickly as possible for the economy, for sports, for cultural activities. On the other side of the scale, don't let the infection rate get above 1% and keep the virus at a manageable level. That's always been the balance. New York has achieved that balance extraordinarily well. Well, you're the New York governor, of course you're going to say that. Yeah, but also it's undeniable on the numbers, right? How did we go from the highest infection rate after ambush to one of the lowest infection rates? Because we achieved that balance well. Not a personal opinion. It's a numerical quantifiable fact. So, yes, other states have done other things. Really, on the numbers, you'd want to go to those other states and say, you notice your infection rate keeps going up and ours keeps going down? Maybe you want to reconsider your balance beam of decision-making. But on the balance beam of decision-making, our decisions have been proven correct on the numbers over these months, right? So at one point, I know you're the Post Standard, but at one point, it's not political opinion. It's not political theory. It's not Democrat, Republican, liberal, conservative. It's just in the numbers. But Rob or Beth, you want to comment on football specifically?
This is Robert. So, I mean, as the governor mentioned, we're using the guidelines that we've been used in limiting low-risk sports, medium-risk sports, and then high-risk sports. Right? Those definitions really come from the Department of Health, looks at the activities, and then, as the governor points out, because we've allowed low-risk sports, right, that has contributed to our very low infection rate at this time. And we have seen clusters of infections that have happened and be related to sports and high school sports. In other states, and even people that have violated our guidelines and have gone to other states in tournaments have become infected. And those have been documented. So we're continuing to look at the sports. We're continuing to work with the Department of Health. And once we feel comfortable that you can go to the higher risk sports, and higher risk, what does that mean? It really means closer contact, more touching, more difficulty in mitigating that. The guidelines, we've updated the guidelines multiple times in the last month. So we'll continue to do that, right, as we monitor the infection rates and as we see what is happening. So you asked for in the timeline, to have a specific timeline, but as you can see, right, we've updated the guidelines multiple times, and as soon as we feel it's safe and the department feels it's safe, we will update for additional sports.
Is there a specific, I mean, so the kids can start practicing, obviously, as the governor said. At some point, you know, maybe it's more prudent to think about a winter or spring season. Is there any general guidelines as far as, well, we can have them practice for 2-3 weeks before making a decision, or is it a kind of a floating thing along the way?
No, I think we'll do it before, right? So we made these guidelines that came out, right, in advance of the season to give time for preparation. So I think we'll do the same again, right? As we head into the fall, the sports that have started, we're going to monitor them. And if we see that worked out well, then we can modify the guidelines in advance, right, of certain tournament play and certain seasonal changes. It'll be before those games start.
So there's no magic number as far as infection rate, 0.7, 0.6. It's just a feel or an extended feel.
It's not a feel, right? So it is. We actually are looking at the rates themselves, but the rates fluctuate, right? As the governor points out, we've been low, but there are parts of the state that we're seeing fluctuations in as well, and have gone up above 1%. So we're looking at that. So it's not a feel for it. We're looking at it, and we want an extended period of time with a low infection rate. Where we see clusters and where we're seeing infections are social gatherings and large groups in close contact, right? That is the majority of clusters and infections that we're seeing. We want that to slow. And as we're going into school, we're going to see a lot more of this activity we haven't seen before, right? School starts, all those low-risk, medium-risk sports are going to start. We're going to see those people together, and they're going to watch that activity. And if there's no infection and the guidelines are working, then you can go to the next step.
Yeah, and Rob's point is very well taken. And just remember, there are factors that you have notice of that are developing. We're coming into the fall. The flu virus will start. That will reduce your testing capacity. Schools are coming back. you have evidence already of clusters popping up with universities. K through 12 schools will be starting. You can anticipate, if you're logical, clusters popping up when schools start reopening. You have evidence already of caution flags. Western New York, 1.4%. So you are already on notice and have evidence of factors that are coming that could very well complicate the situation. So don't be reckless. Act intelligently and follow the science.
Just one other point on that, Governor. We're also in line with 16 other states that have delayed competitive play at this time. So we're consistent with those other states as well.
Operator, let's take one more.
Mm-hmm. Next question, Jessica Moore from WCBS TV.
Good morning, Governor. In the past, you've said that you do take some guidance from the CDC when implementing rules for New Yorkers. My question is, will these new quarantine guidelines change your position on the quarantine rules for New Yorkers? And how would you advise companies in the state to move forward? A lot of them look to the CDC to say our employees need to quarantine 14 days if they come back from a hotspot.
We're not going to follow the CDC guidance. I consider it political propaganda. I would caution private companies against following the CDC guidance. I think it is wholly indefensible on its face. I think it is inherently self-contradictory. It is the exact opposite of what the CDC has been saying. So either the CDC is schizophrenic or they're admitting error in their first position, or this is just political dictation. In any of those events, I would urge people not to follow the CDC guidance. I'd urge them to follow the state guidance. And I'd also gratuitously recommend to them, speak to public health experts, speak to the leading epidemiologists, speak to the academic university health experts, and ask them what they think of the CDC guidance, which I have done, and none of them recommend following it. Dr. Zucker, anything else on that?
Yeah, as you said, Governor, we're staying the course. Stay the course. I agree.
And remember, the CDC has been wrong repeatedly. They were wrong in saying the virus was still in China. They were wrong in not realizing the virus had come to New York January, February, March. They were wrong when they said there was no such thing as asymptomatic spread. They were wrong when they said children were unaffected. They are wrong when they said if you get the COVID virus, you can't get it a second time. You know, they have been wrong more than they have been right. And we know that they've been bullied by the president. We know that because he has said it. Okay, thank you guys very much. Bye.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.